I'm very excited to be here with Michael Oberreiter, Head of External Affairs at Roche. We're going to talk about what he's trying to achieve this week, some of the conversations he's been having. Before that, I wanted to ask you about the article that you've recently written about healthcare spending and healthcare within the broader search for prosperity in the global economy. Maybe you could summarize it for us, and then we'll talk about this week.
Yeah, so it's super interesting because while here all the finance ministers are meeting and the big guys from banking, at the same time in Berlin, all the health ministers of the world did meet. And I think it's actually what I try to flag in my article, that those two words need to come closer together, because I hear a lot about health as a liability, but I hear very little about health as an investment and health as an asset, which is basically the essence of the article.
Why do you think that dichotomy exists? Why don't these worlds know each other better?
So I changed my mind over the course of the last days, because I kind of assume that finance ministers are very intelligent human breed of people. So I can only come to the conclusion it's probably a mix of being a little bit ignorant towards the fact, because health is not screaming. Mm-hmm. So there is literally a crisis going on a daily basis, which are the non-communicable diseases, which are a big problem for the G7 countries, the G20 countries, and also for the low and middle income countries. Mm-hmm. But it doesn't make the headlines because it's gradually shifting the tide. And in combination with the aging population, this is the biggest killer of productivity, in my opinion, that we're actually facing right now.
And have you made some progress in advancing this point?
I would not go that far, but we have become better. So what we are also trying to do is, I think health needs to learn to speak the language of the finance and the banking world. So we need to talk more about health, less as a welfare, but really as an investment and as a return of investment you can achieve when you invest in healthcare. Because the numbers and the data and the evidence, there's a compelling cause for health actually, because we know G7 only, very simple number, is like $1 invested generates $4 of guaranteed return of investment.
Okay, very interesting. So I would agree with you that finance ministers have neglected this field, and I'm happy that you're advancing these arguments. However, the institution we're sitting in, the World Bank, does do work on healthcare. So I was wondering if you found any allies in your quest to advance this point in the economics world, but people who do know about health.
Yeah, so I give the World Bank credit what they're doing in healthcare, but they're looking at a very old-fashioned view of healthcare, because the World Bank is predominantly focusing on still infectious diseases, which is a big healthcare risk in low and middle income countries, but the numbers tell us something different. Like, we just know that non-communicable diseases, and we're talking here about cancer, heart failure, diseases, diabetes. So if we look at those diseases in general across the world, the numbers are the same in every country, which is like 70% of deaths across the world are caused by those. Mm-hmm. So you cannot only focus on the infectious diseases, which is important, but you also need to build for those non-communicable diseases at the same time.
And this, I mean, when we talk about investment, the numbers are quite big. You need to put a lot of money into these resources, right?
Yeah, but I think the problem is a little bit, or the opportunity as well, is being way more clear on the investment case. Our problem is basically you invest in healthcare, but you not necessarily generate the return within the next 12 months.
Okay.
Sometimes, even when you talk about prevention, right, it's not even within a legislative period.
Yeah.
Which is a fact, this is the big problem.
When you come back to the spring meetings or the annual meetings 2030, what differences would you like to see?
I would love to see that when we talk about, because what I learned, so where everybody's concerned around here in these halls is about productivity, it's about economic resilience. I would love if there's a better acknowledgement of you cannot have productivity and you cannot have economic resilience without a resilient healthcare system. Mm-hmm. As simple as that. I want to have the same space, because right now, if I look around here in these meetings, healthcare is not on the menu. It's not even a side dish. Okay. And I would love to see it on the menu.
So give me, resilience is a really important word. It's a sort of buzzword that finance ministers respond to. You're absolutely right. But what are one of the examples you give them of investments that can be made that will be expensive in the short term, but make you more resilient and be cost effective in the longer term?
I can even give you an example for an investment that would not even be that expensive in the short term. It's like investing more in prevention. Because the problem is, we know in those NCDs, you can actually prevent 70 to 80% of cases of those non-communicable diseases around that. So if you would start investing more, and there's a number out there, this is true across all the systems, currently we're investing between 1 or 2, maybe 3% into prevention. You could double the number and you would immediately achieve a return of investment.
I was convinced, hopefully, I wish you good luck in your quest, and I do hope that in the coming years we see more of a focus on health and its effects on the broader economy.